Reza. I'm Abby.
Hello, nice to meet you.
Nice to meet you. I'll be your student physical therapist today. First, can I just have you verify your date of birth for me?
January 14th, 1985.
Awesome. Okay, so I've been reviewing your forms, and it says that you're here because of some pain in your right neck, and then also some headaches you're getting on that side.
Yeah.
Can you tell me a little bit more about when you started getting these headaches?
Well, it started mainly at work. I would start to get, it would be just a headache, and get the neck pain, and then it would move to the head, and then it became more frequent.
Okay. So how long ago do you think it was when you got your first headache? How many months ago?
Probably 6 months ago.
6 months ago? Okay. And just to let you know, I'm listening to you, but I'm going to be typing, so that's why I'm looking at my computer. I don't want to miss anything.
Okay.
All right. And so you said you get them at work. Is there anything that, like, at work that makes them come on?
Well, I'm a dentist, you see, so
Okay.
I'm leaning over people a lot. So when I'm like leaning over, crouch kind of over them, that tends to be when it happens. And then yeah, if I'm like sitting at my desk as well.
Okay. So do you ever, so you get them like during long procedures?
Yep.
Yeah, makes sense. You're a dentist. Do you ever get them not at work, like when you're at home? Or
Yeah, when I'm writing on my notes,
Mm.
or I'm doing something where like just kind of leaning over.
Bent over?
Yeah.
Does driving hurt ever?
Yes.
Yeah. Okay. And so you said the pain is worse during the day and at night, correct?
Yes.
And this pain at night, does it affect your sleep very much?
Sometimes when I'm going to bed, it can stop me from going to bed due to the pain, but once I'm asleep, I'm okay.
So does it ever like wake you up in the middle of the night from the pain?
No.
Okay, that's good. And how would you describe the headache and pain in your neck?
So my headaches are more like throbbing pain,
Okay.
and then in the neck it's more of a spasm.
Okay. And where do you feel the pain in your neck? Is it primarily on one side?
It's on the right side, in the back.
Okay. So does it radiate anywhere else, like down your arm?
No.
Okay. Just the headache on the same side.
Yep.
And have you been a part of any traumatic injuries recently, such as like a car accident?
No.
No? And no recent known concussions?
Nope.
Okay. Which head movements are most difficult for you?
Turning to the side, usually.
Okay.
Yeah.
So I also see on your intake form that you tried acupuncture,
Yep.
but that didn't have any relief for you.
No.
Have you tried anything else to help with the pain?
I take like some pain medicine.
Oh yeah, I see it on here. Toradol?
Toradol, yep. Just one a day.
Do you take that a lot or just once a day?
Just once a day, yeah.
And how are you finding that?
Doesn't really help that much.
Okay.
Yeah.
Probably not the best side effects either, huh?
Yeah, no, I don't like taking it like every day because it makes me drowsy and that doesn't help with the work. So it's
Okay.
only if it's really painful I'll take it.
Okay. And then, does it help when you lay down? Does that ever help with the pain?
Yeah.
Yeah? Okay.
Yeah. That's the only relief.
Thing that helps.
Yep.
And I also see that you got some x-rays done. Did those show anything?
Yeah, they showed some degeneration in the back of my neck.
Okay. Was it the facet joints?
I think so, yeah. That sounds about right.
All right. Almost done. Oh, I also see that you're here through direct access.
Yeah, that I went that way because after acupuncture, I couldn't get like a appointment through my doctor to get a referral to here.
Because of a wait or?
Yeah,
Yeah,
the wait was
like
just too long.
Okay. But last time you saw the doctor, you had all these same symptoms, and that's why they gave you the x-ray, right?
Exactly. And they actually recommended PT, but I wanted to try acupuncture first.
Okay, so they cleared you that.
Yeah.
Okay.
Yeah.
Okay, so now I'm just gonna ask you a few questions, just to rule out some bigger problems that may be present, just before we get started. Have you recently experienced any abnormal sensations such as numbness or pins and needles?
No.
No? Have you recently experienced lightheadedness or dizziness?
No.
Have you recently experienced easy bruising?
No.
Do you have a history or a family history of cancer?
No.
All right. And then pertaining to your headache, when you do have one, do you usually vomit from it?
No.
How about have difficulty swallowing?
No.
Any vision changes?
Nope.
And then any severe sensitivity to light or loud noises?
No.
Okay, cool. So thanks for bearing with me. That's all the questions that I have to ask you. So now I'm just gonna take a couple measurements and do a couple tests to try to figure out where that headache and pain in your neck is coming from. That's gonna involve me like moving around, touching your head and neck area. Is that okay with you?
That's okay, yeah.
Okay, so we can get started. So I'm going to do a few tests. I'm gonna try to do the test that I think might bring on the headache at the end of the exam, so you won't have it the whole time. And then I'll try to do something that helps with it so I don't send you home with a big headache, okay?
Okay.
So first I'm just gonna look at your posture. So you can just sit how you normally would, like while you're typing at your desk. Okay. I'm just gonna have you straighten up a bit here. Good. Try to hold that. All right. And then bring your head back a bit. Good. In this area. Okay, good. Let me write that down. All right, and then I'm just gonna see a basis of how you move. So if you could stand up, please. So now I'm just gonna see how you move a bit. So I'm gonna have you go up, good, onto the side, good, on the back, good, here, good, and then you're just gonna look down, and then look up, and then look to one side, then look to the left, alright, good, okay, let me write that down. Alright, you can sit here please. So I'm just going to take a couple of measurements now to see how much range of motion you have there. And so the movement that you're going to do is you're just going to look down to the ground. Good. Like this. Is that as far as you can go?
Yep.
Just going to push down a little. Don't do much. All right. Good. And now I'm going to have you look up. Good. A little more. Good. Come back down. Come behind you. Can you look down for a second? Good. Look back up. Okay, good. You can look forward. All right, so what you're gonna do is you're going to bring your left ear down to your shoulder. Okay, good. Back up. And now you're gonna do opposite way. Okay, good. All right, you can come back. Let me break that down. All right, and now what I'm gonna have you do is you're going to stick your chin out, this, good, and come back in, okay, and then look down, and then rotate to your left, okay, and then rotate to your right, okay, all right, good. All right, and then I'm just gonna do one more test, sitting up. I'm just gonna look at some mobility in your rib. So I'm gonna have you rotate and then loudly flex. Okay, feels fine. I know you can't rotate too much, so I won't go too far. Okay, good. Write that down. All right, can you lay on your back for me, please? Head over here. Good. All right, so I'm just going to measure how much you can rotate your head right now.
Mm-hmm.
And so I'm gonna do it, rotate to the left, because that's the one you have an easier time with. So can you rotate to the left? Good. Okay. All right, you can come back. All right, now go to the right as much as you can. little bit more. Good. Okay. Back. All right. Now I'm just gonna do a couple strength tests just to see how your muscles are. And so first one, I'm going to look at the strength of some of your deep muscles in here. So what you're gonna do is you're gonna give me like a double chin, and lay flat, and I'm gonna try to pull it this way and try to pull off your double chin, okay? But I want you to resist it.
Okay.
All right, you do it. All right, good. All right, next we're gonna do an endurance test. And so what you're gonna do is you're going to do that same double chin, but then you're gonna lift your head off the table like this. You're gonna try to hold it for as long as you can. Okay? And then I'm gonna be under you, so in case your head falls, you won't just smack the table, okay?
Okay.
So let me get the timer. All right, whenever you're ready, you can go. How'd that feel?
It was difficult to hold, yeah.
You got 24 seconds.
Oh, close.
All right, now we're gonna do one more thing. Let me grab it. All right. So I'm gonna put this pressure feedback cup underneath your neck. Good. And so I'm gonna pump it up to 20.
Okay.
And what is gonna happen is that once it goes to 20, then you're going to do that same double chin position and you're gonna try to make it go up to 22. You're gonna hold that for 10 seconds. And then you're gonna relax for 10 seconds. And then we're gonna go up another 2 to 24. Hold for 10 seconds. Repeat. And you're gonna try to get to 28. Okay? So let me pump it up a bit. All right, and when you're ready, you can watch it yourself. 2, 3, 4, 5, 6, 7, 8, 9, 10. Good, relax. Good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, and then again. 1, 2, 3, 4, 5, 6. Okay. Good. How was that? A little tough?
Yeah, that one was, the second one was harder.
Okay. Yeah, that's okay. All right, now I'm just gonna test the length of one of your muscles. So you know your pec major muscle? Yeah. So what I'm gonna do, I'm gonna come on the right side. I'm gonna put it right here, and then I'm gonna let it drop. I'm just gonna see how close it gets to the table. Okay, so as far as you can go?
Yep.
Okay. And move it up a bit. Go down. Okay. Seems like you might have a little tightness in that pec major.
Yeah.
Yeah. You feel that?
I do.
All right. Can you sit back up for me, please? All right. I'm just gonna do one more test just to rule out, make sure it's not something to do with your thoracic right here. And so I'm just gonna take your arm and I'm gonna abduct, then externally rotate, and pulse. And I want you to look to your left side. Good. Take a deep breath. Good. No pain.
Nope.
Good. All right, I'm gonna do the other side. All right, like this, deep breath. Any pain?
No.
Okay, good. Doesn't look like that's the issue here. All right, lie back down for me one more time. All right, so this is at the part that a few of the things I'm gonna do might give you a headache, but just let me know if it ever gets too much for you. So I'm just gonna touch around in the area. I'll touch on your left side first. Shouldn't be anything, hopefully, irritating over there. Nothing. Your neck, down here. All right, we'll touch the other side. Let me know.
Oh yeah.
Some pain there?
Yeah.
A little bit of a headache?
Yeah.
Okay.
That's how it starts.
Yep. All right, and then another test. So what I'm gonna do is I'm gonna flex your neck, and then I'm gonna rotate you. I'll rotate you to your not painful side yet. I just wanna see how much rotation you have with me. I'm gonna go, just let me guide you. And then tuck your chin in, good. Good. Nothing there?
No.
Alright, I'm gonna do your other side. Let me know if it gets too much.
Oh yeah.
Yeah. Good. Alright, last thing, I'm gonna try to make that headache go away a bit. So, go on your stomach, please. We're almost done, I promise. Is it okay if I lift up your shirt a bit?
Yeah.
Yeah. So I'm just gonna look at your thoracic right now. Just making sure it's not, the problem's not here. Doing okay?
Yeah, that's fine.
Yeah, feeling good. Go up a bit. Still feeling good.
Yep.
Okay, good. Now I'll go up here. I'll see if this makes the headache go away at all, okay?
Oh yeah.
It's feeling a bit better?
Yeah.
Okay. All right, good. All right, thank you so much. You can sit up for me. I'll go over some findings. All right, Marissa. So, what you have is actually, I hypothesize, something to do with your neck pain, and that's referring into your head and actually giving you the headache. So it's more of a neck problem than a headache problem. Yeah. And so some things I think we could work on to alleviate that pain is we're gonna work on your posture. You have a bit of a forward neck.
Yep.
And that's probably as a result of you like typing and then leaning over at your job. I know you have to prolong those postures a lot, so we'll work on that. I'm also going to work on strengthening those deep neck flexors, all of the things that we did with that. Those need a bit of strengthening and coordination. That should help. I also want to stretch that pec major. Looks a little tight. That could be contributing to it. And then I want to improve mobility in that upper cervical spine. That's what I was doing for the modes. That helped a bit. So those are a bit tight, so they could do with some mobility. And I also I'm going to suggest going back to the doctor just to get a referral. I know like you're down to do that, but it was just a wait time. But sometimes insurances, they kind of direct access can get a little, or I just don't want you to have to be paying out of pocket all the time. So if they were down for PT, then I recommend that. And then also just keeps them informed about the headaches, and then I can collaborate with them and just find the best treatment for you moving forward. Does all this sound okay with you?
That sounds good to me.
Good. All right. Well, I'll get you scheduled at the front desk.
Thank you.
You're welcome.